The biggest reason for choosing IMS was a detailed use that we have for allergy in the program. It is and has been the most thorough EMR for use with allergy in terms of allergy shots and allergy mixing that's out there. In addition, it's very competent when it comes to general day-to-day chores, from seeing patients and getting labs or sending prescriptions or having patients fill their forms online. All of those features were very important in our decision at that time.
When I was hired with Spring Creek, they were already using IMS. However, they had recently just switched from one entity to IMS, and it's my understanding that they did that because it's such a well-rounded product, encompassing everything from the andrology, embryology, lab side, clinical, all the way to your practice management for billing and scheduling.
Through my experience with Meditab and IMS, they were very willing to work with us. Being so new into adopting an EMR system, this was our first EMR system, and we've kept it for the last 11 years.
Back in about 2009 or 2010, our administration team, they actually dealt with our vendor before with the previous EMR system, and that was just for billing. So now we needed to move into the EMR world, and so IMS is what was being recommended, so we went with our vendor because he was always our IT person. So then we just continued. We did IMS at the time. We tried others as well too, but IMS is what just worked out for us along the way.
You had a lot more of the features that we needed as far as the recipes, being able to document, mixing the recipes, the files, just the documentation.
We looked at a few products. Infertility is such a specialized field that we felt that in IMS gave a more well-rounded between clinical and billing than other EMR systems.
The customizable aspect of it, we can make it do anything, and if we help design the OB module that's currently being used in IMS. So if we have a mission or a profession that we want to start, a clinic that we want, then we can go in and start with your team and design pretty much any practice that we want.
So we like IMS because it's a really complete software solution. It has different modules and our practice is super used to it. It has different areas that other solutions doesn't have. The capability of the software is super and it's really complete comparing to other ones. I have been comparing other ones and they have some of the modules, but IMS is really complete.
Why we went with IMS, because I think a lot of it is related to patient experience, what we can offer patients, and a lot of in other softwares would consider ancillary products that you buy from different vendors built on that help that patient experience. Where IMS we found really offers that in an all-in-one platform, so we can really get our patient engagement up, we can have a better patient self-service portal experience for them, and really increase the level of care we're giving them.
What really impacted them is the ability to make it what we want it to be. So there are other fertility EMR systems that are basically, this is what it is, and you have to work your schedule around or work your process around what this looks like. So the nice thing with fertility EHR is that we were able to really have an active part of figuring out what works best for us and how we can utilize this for efficiency, workflow, and also be able to customize it to providers, customize it to the staff, and make that process easier, as well as the support. I think from the very beginning, we've had great communication with the IMS team. So that means a lot to us, right? If we're having an issue, the ability to reach out to somebody and have an immediate response it's nice.
The decision-making process that went into choosing IMS, it was multifold. IMS, it's one system, one login, and that's very convenient for us as a federally qualified health center that provides multiple service lines, everything from podiatry to medical, dental, optometry, behavioral health, obstetrics, and we were able to use one system for all of those.
They really understand the allergy aspect of an EMR, and it's just been really nice that it feels like it's built for us and custom to the allergy world.
Meditab came, the owner. He started talking about UDS. He started talking about things we talk about, patient care, quality care, and staying up to the needs for HRSA. And we were like, this is something we've not heard out of the EMR vendor. The more we've seen it, the more we've seen that you guys are small, we're small, let's grow up together. So it was like assigned the RFP, and that's where it all started.
The shot module, the allergy formulation templates, the scheduling, that of course helped, but also the billing aspect they offered. It helped us move into a phase that we didn't expect to move in, and it just helped us become a better facility. We started in 2012 with Meditab, and the growth since joining Meditab, it's something we did not foresee. So it has been hands down awesome.
So initially when I started the practice, I had used a different electronic health record, and our software support team informed us after 4 or 5 years that that software was no longer going to be supported and wouldn't meet some of the requirements for Medicare and for some of the insurance plans as far as what they wanted from an electronic health record. So we switched to IMS, which was a product they were going to be supporting at that time. And we've been with them now since 2010.